Good morning, everybody. It is Randy Hilarski. Today we are talking about the coronavirus, COVID-19, and the possibilities of treatment. And I've got my friend Adrian Bai here, who is the author of the article entitled, "Does Italy have more COVID-19 deaths than South Korea because they're not prescribing chloroquine?" Now, Adrian, please tell us your background because people are going to want to know who you are and why you have some authority to talk about this.
And that's a good point because I don't have any medical or scientific qualifications at all. My major point here are two things. One is that I lived from 2014 to 2016 in central China, in Hubei province, where the virus is. So I'm very familiar with China. I'm familiar with how Chinese think about these things. And then the second is I've been studying a lot of philosophy, and I'm really interested in things like a lot of your viewers are interested in crypto. So how do we achieve consensus? How do we know what's true? And that's a central topic of mine. And I think we're not doing a very good job in the West at the moment. And that's what triggered me to start looking into this, because I wasn't comfortable with what's happening in the West. And so I've borrowed from thinking from China, understanding China, and then looking at opposing viewpoints from what we're seeing in the West to get answers that I think are stronger.
Okay, great. And we're already seeing coronavirus, supposedly the numbers are dropping and things are normalizing in China already. Could you give us a little bit of background? What's going on over there? Why are they seeing such a rebound already?
I think they've gotten it under control, and I think that the reason is this medication. I don't have any. I sometimes get this online. People say you're just like being paid by China to say things, and like I could care less. I'll say what I think. I think China is getting this under control, and I think they're doing a good job. And I think the reason is this medication. If taken early enough when you get sick, it stops you from becoming a really serious case. And it does actually cure you. I think we actually have a bunch of options, and I listed them in the paper. But the big one, that's a really old one, is chloroquine. This is counterintuitive for the West. A lot of our doctors have become really, they're doctors. They know what's going on. And this is a malaria medication for treating a virus, which makes absolutely no sense whatsoever. I think it breaks their model of how you think about treating illnesses. But I'm not a doctor. You're not a doctor. I'm interested in what works. And we've got a lot of papers from China and Korea. And I've seen Singapore is also using this as well, saying that chloroquine works. And so, actually, I'm probably not even pronouncing it. I've never actually said the word. Chloroquine? Is that how it's pronounced?
Yeah, chloroquine. Yeah.
Chloroquine. Okay. Because you have a lot more experience with it than I do, since you worked with it in the Navy. But I looked at what are they doing, and then how are their numbers performing, and then looking at the West. And I was worried, actually, looking into this for my mother in Australia, because I think climate's also a factor too. She's in a cool climate. And what is she going to be treated with in Australia? And I started looking at the government health sites, and there was no answers. And then I started, well, where do they get their information from? And I look back, and it comes from WHO, and WHO said that there's no treatment. And then I looked at the CDC, and the CDC said there's no treatment as well. And I'm like, hold on a second, China's getting these good results, so they say. And then I started looking, and I asked some friends and all of that sort of stuff. And my friends are saying, yeah, like we think they're really getting it under control. And
Yeah.
So I started to really think about this very differently. Yeah, there's my piece.
Yeah, I'm sharing your article here just so people can see it on the screen. This is serious stuff, and I know even if I tell people, look, think about chloroquine. Well, that's also scary, because when we gave chloroquine in the Navy, we always had to monitor the patients really closely, and we gave it to the guys who were going to Africa, here to Panama, to places where there was malaria. And it's a very serious drug, and it can hurt your liver. You need to be monitored. It's not something that you just do on your own. You need to have your blood checked periodically to make sure that your liver's good and other symptoms don't arise. But tell people about your experience. You were talking about using it we were discussing before we actually started the video about using chloroquine as a prophylaxis, but that's not what it's designed for.
Well, I mean, this is what it's really interesting, right? So because this is malaria, the primary use has been for preventing malaria. So what you do is, if you're going to go to an area with malaria, you take a small dosage once a week, and then you're probably not going to get infected with malaria even if you get bitten. So then the logic can then say, well, if it works for malaria and it also is used for treating malaria, then potentially it can be used for preventing the coronavirus too. And I bought a whole lot for the older people in my family to send to them, because I'm like, it would be better if all of the older people in my family didn't die from the coronavirus.
Absolutely.
And then I had it all ready to send, and started realizing, well, they're probably not going to take it anyway, because why are they going to trust me to send them some malaria medication? And that just doesn't make any sense either. And their doctor's not going to agree with it. And who knows how it's going to affect older people. And I thought, well, I'll try it myself and see what happens. So I took exactly what is there, hydroxychloroquine, and I took 400 milligram pill, which is the CDC dose, and I got a lot of side effects. I was really shocked. I took it exactly as you're supposed to with food, and I got rash on my face, which I never get rashes. I got headaches. I felt sick for 4 days, and I'd been doing a lot of reading about how if you take this long time, it can cause blindness. It can damage your retinas. And actually, I got blurry vision for a day or two. And one of the other funny, it has like a gazillion side effects. So another side effect I got that night is I had terrible nightmares. I never have nightmares. I had terrible nightmares that I lost the vision in one of my eyes because of the medication. I woke up and I'm like, man, I'm blind in one eye. And this all just like came out of nowhere. And so people online, there's been an article published online about chloroquine that Elon Musk tweeted. That was actually some guys that I know. I think it was some of my tweets that actually triggered them to write that article. I'm credited in the article, or I'm acknowledged, but there's the tweets are all still there. I think you have to be careful if you're taking this. People are getting the impression that it's like aspirin, and take a lot of aspirin and you die, and that's true. But chloroquine, it's a tough drug. I actually looked into it when it was being discovered in the 30s and 40s. The Germans actually said, "Hey, this stuff is too toxic, and we're not going to keep researching it." So they stopped. And then it was only later on that people decided to keep investigating it. It's a good drug. It does a lot of things. But it has a lot of side effects. Another really interesting side effect people have had, it changes their hair color.
Really?
So just be aware that, like, it seems to me almost like anything can happen, but it does seem to cure the coronavirus, and it seems to be a miracle cure for coronavirus.
I see these others are also like lopinavir and ritonavir. Those are for HIV treatment. Right. I'm seeing some of these antivirals, which is pretty interesting. There's a couple things that they're trying out to see what works. What are they doing in Korea? Because I know that you wrote about Korea in the article.
Yeah, I mean, I only have data from like a month ago, so this is newer. This showed up, and this is a translated version, so we can't even be sure that these doses are right or that it's been translated correctly. I just posted it because it's the best that we've got right now, and it's probably right. But it was posted in Spanish from a Spanish hospital service or a medical service, a pharmaceutical service. And then someone then went and translated it, and it looked right, so I posted it. The Koreans, the information that we have is could you go back to that? I was actually reading it.
Oh, sorry.
The Korean one is the lopinavir and ritonavir, and then chloroquine, those two. That's what they're saying. However, it wouldn't surprise me in the slightest if they're using all 5 of these now, given that this has shown up. But I don't know. I don't have any data. I just wanted to put this there because if you do get sick and you don't have any options, you can at least go to your doctor and say, look, these strange guys on the internet think that these work. Can we research these, and then can you see if these dosages are right? It gives you a starting point. If we are getting bad information from who and they're not giving us actual information, you have something to work with locally. So yeah,
I know that I can go down to Arocha. I'm in Panama, and I can go down the road to Arocha, which is a pharmacy, and pick up a box of chloroquine for $25 or so. It's a generic now. It's available. A lot of companies make it, so it's not difficult to get. Here in Panama, I'm lucky that a lot of things I can buy over the counter. So that's pretty cool.
Right. But even still, and a lot, but it would be a good idea if you're doing this is to work with a doctor on it to make sure that you're doing it, you're not screwing anything up.
Absolutely. I actually have a good friend here. He's a top pediatrician in Panama. So if I ever need anything, I just call him up. That's a great thing about being connected and knowing people where you live, wherever you're located, building your little community and that you could ask questions to. And just being on a lonely island, it can get it. Not one is lonely, and two, that you don't have the information, you don't have people that you can count on when the time gets rough. And I'm just lucky that I've been in Panama for 10 years and I made those connections. And what I'm going to do over the next couple of weeks is I'm going to share as much information as I can that comes across my desk with the local community to help spread awareness. And when I saw your article, I'm like, oh man, I got to talk to Adrian about this.
Well, I'm glad. The other thing is that, when I mentioned earlier about philosophy and how we know what's true or consensus, CNN actually 12 hours after I published my piece, published what appears to be a total response. It doesn't mention mine, but it basically has counter arguments to everything that I said. So I think it's a really good idea to look at my piece and then look at the CNN piece and see which one you think is true. CNN basically is saying that it's the health systems, and basically they're just disagreeing with everything that I've said. So look at both and see which viewpoint you think is right. I don't think WHO is giving us the right treatments, and I think that's the cause of the really high death rate in Italy. And I don't think it's necessarily related to age and all these other things.
Absolutely. The other one, I think I sent you back an article talking about what happened during the Spanish flu epidemic, where they were actually using outdoor treatment because air outside is antiseptic, and giving people vitamin C, and they got the vitamin D from the sun because they were outside. These are natural treatments that have been around for a long time. And just this modern medicine is just in the last century. And before that, we had lots of other ways. And I think people should pay attention to how the Spanish flu was treated. And once they started doing the outdoor hospitals, the tent hospitals, the Spanish flu really plummeted the amount of new people getting sick, and that people were recovering. So if you live in a nice place with, like I do here in Panama, I can go outside, get some sun, take some vitamin C, or maybe go grab a papaya off the tree and get some vitamin C and help strengthen my immune system.
Yeah, well, one of the things that WHO is also not talking about is the impact of climate. And I think this isn't confirmed yet, but I would say 90% sure that the virus is less infectious in a warm climate. One reason, I think, is because the virus dies. So if it's on your skin and you're outside, the temperature, if it's above 24 degrees, they're saying that it doesn't survive. And so when summer comes, it doesn't mean the virus will end in summer, but when summer comes, it'll be a lot less infectious. So we have an easier chance at ending it. But then the second thing is, when you get sunlight, you get vitamin D. I don't agree with the theory, and I'm very skeptical of people talking about taking vitamin D pills. I don't think those work. I think, and if you're in a cold climate, I think you need a sun lamp. But that may well work. Maybe, everyone that's in a really cold climate, you get a sun lamp. I have one, and you just use that and, use it for 30 minutes a day, and that may help with immunity. I don't believe in vitamin D pills. I don't think they work.
Yeah, I totally agree. The natural way. We go for a walk every night around 4:30 p.m. Between 4:30 and 5. So the sun is on the horizon. So it's not baking us, right? So we go out, get some sun, take the ball out with our son out to the field where there's nobody around, where we're still practicing social distancing, just my family. And we go out, kick the ball around, have some fun, get some sun, and get some fresh air, then come back home after about 30 minutes. And we feel great. You get a little bit of exercise. You're getting out of the house. So if you can do these things, we have the opportunity. I would take advantage of it.
Yeah, for sure.
All right. So what do you recommend people do going forward?
It's right now, it looks very negative, that the world's ending and, crypto's crashed and the markets have crashed. I think China's got this under control. If it turns out that they're lying in Wuhan and it's all being staged and, there's stuff online, then I'll change my view. But I think China really has gotten this under control. I think the West is not listening. I think that particularly in the UK, they're following some really horrific advice. And a lot they're based on not believing China's numbers. I think we're right to be skeptical of what China says, but I think this time they're doing things right. So I think be careful, do quarantine and the things that you're supposed to do. But there's medication. You have a list there, so you have options. But hopefully what will happen, what would be good, is if my article gets spread more, that starts to put more pressure on the system. And so that then these sorts of medications will become public, that where we need to be prescribed them, and then they'll be made, and then you'll be able to get treatment locally, properly through the system, rather than having to work around the system, which is the way it seems to be right now. One other thing I really want to add in that is that chloroquine is a generic, cheap drug with no patents, and so there's not going to be shortages of it once we stop being idiots and we realize it's important and are making it. So it's sort of, the numbers are sort of like within a week we can have enough for everybody. It's a non-issue.
No, that's great to hear. You know, I love it when things go generic and we can get it easily. So follow Adrian at Adrian By on Medium. Is that also your Twitter handle?
Yeah, that's my Twitter handle.
Okay, great. Yeah, so go check out the article, guys. It's on Medium. Share it around. Give it some claps so that it starts ranking up higher in Medium. I'm going to continue to share it every day because I think it's important. We need to have some alternative viewpoints on treating coronavirus. And when I say alternative, it's so far, it looks like just the Eastern countries are realizing that this is an important treatment. Western has still got their heads in the sand. So this could get much worse before it gets better. I think we agree on that. I think so. Yeah, so I'm just glad I'm here. I live in a beautiful country with warm weather. I've got my family here. We work from home, so we're blessed. You know, crypto, everyone's like, oh, it's falling through the floor. I don't think it's that bad. I think it's levitating pretty good compared to a lot of other things, and it could bounce back really quick. Just a quick note about crypto is that, you know, during the 2008 crisis, I was a big gold and silver guy, and I watched my gold and silver plummet. And during the actual crisis, but shortly thereafter, for the next 2 to 3 years, it rocketed because of all the inflation that they put into the system, and they're doing the same mistake today. So own your crypto, gold, silver, and protect your finances.
Right.
Well, thank you, Adrian.
Hold your own keys. Don't leave your crypto on the exchanges.
Absolutely.
When things are really going to happen.
Let me show you. Look, there we go. I got my ledger blue.
Oh, very nice.
Hold your own keys, guys. All right. Thank you, Adrian. Thank you for making the time today to tell everybody about chloroquine and the different options that we're seeing that the countries in the East are using, and helping to slow down the spread of this coronavirus.
Thank you for the interview.
All right. Cheers, brother.